The sterile processing department is a cornerstone of our hospital's infection prevention and quality programs. Our goal at RGH is to provide a safe experience for every single one of our patients, and sterile processing is essential to that process. It's important that we send to our operating room instruments that are sterilized and sanitized and ready for use by our surgeons. The new sterile processing space is amazing as compared to the former space. In our legacy space, the footprint is 5,000 square feet. The footprint in the new space is 20,000 square feet. We've moved from working with 4 steam-generated sterilizers to 7 BellyMed sterilizers, which are state-of-the-art technology for sterile processing. We're able to achieve better outcomes with the new state-of-the-art technology that we've implemented in the new SPC. So for example, our Medivator. This is a process that we can use to clean and disinfect and sanitize all of our scopes without really any human intervention. What we would call dirty instrumentation comes from our operating room in an elevator, and it's received in our decontamination side. At that point, the staff soaks the instruments in an enzymatic cleanser, and then they wash the instruments or prepare the instruments to go through a washer.
The patient is our #1 priority. SPC is a combination of both the instrumentation and trays portion, as well as the supplies. And it's really the marriage of those two that is housed down here in this incredibly new, wonderful SPC. Every item that we supply in this hospital for an OR case has a home. Think of aisles, racks, shelving, positioning on that shelf. Behind the scenes, there's a lot of inventory planning that goes into play. We have about 10,000 items. Technology is a big part of the new inventory management system that we're implementing in many ways. The pick list will come up for that case, and it will tell you exactly what bin location to go to. So you go up and down your aisles, just like your grocery list, and you go from category to category, you pick the right item, you scan it, and you put it on your cart. Very excited about our new inventory management system. It's perpetual, meaning we always have real-time visibility of how much inventory we have. And once we use an item in a case, it decrements from that system, allowing us to trigger replenishment. Materials management works very closely with SPC because they're the ones bringing those instrument and trays in. Our team makes sure the supplies are there, the clinical team are picking for the cases, and then it comes back all around, and then we order, replenish, and put away.
I'm excited about moving into this new space because it makes a difference for our patients. It's important in terms of outcomes. It will lead to better quality, it leads to better efficiency and productivity, and it just makes healthcare better for all involved.
If all the supplies are there on that cart, on time, in full, going into that OR room, now the clinical team has everything they need to get that successful patient outcome.